Welcome to the Life After Cancer podcast, made possible by the National Lottery Community Fund. I'm Steph, founder of Life After Cancer. I've been through cancer myself, and I know that when treatment ends, life doesn't always return to normal. Here we talk about the emotional, practical, and often invisible parts of life after treatment through lived experience and professional insight. These conversations share real experiences and perspectives. They're not medical advice and can't replace support from your healthcare team. If you're navigating life after cancer, supporting someone you care about, or working in cancer care, you're in the right place. Let's begin. Feeling afraid or worrying about cancer coming back is something we hear very often in our community. It is consistently one of the most requested topics in our workshops. Fear of cancer recurrence is widely recognised as one of the most common unmet needs after treatment and can have a significant impact on people's quality of life. It affects many people to different degrees and has become an important area of research. In this episode, we're talking about why fear of recurrence can feel so overwhelming, what can trigger those "what if it's back" thoughts, and what can help when that worry starts to build. To help us explore this, I'm joined by two guests who bring both clinical insight and lived experience. Dr Lidia Schapira is a medical oncologist and professor of medicine at Stanford University. After working at Harvard Medical School, she was recruited to become the founding director of Stanford's Cancer Survivorship Program. Her work focuses on improving life beyond treatment through clinical care, research, and education. We're also joined by Tabitha. Tabitha was diagnosed with breast cancer at the age of 29, just 4 weeks into a new job when she found a lump during a self-check at home during the pandemic. She joins us today to speak openly about her experience of fear of recurrence after treatment, what that uncertainty can feel like in everyday life, and what has helped her navigate those moments of worry. Lidia, Tabitha, welcome. How are you today?
I'm well, thank you.
I'm well, happy to be here with you.
Excellent. Thank you so much both for being here. Lidia, I'd love to start with what fear of cancer recurrence means. Could you explain a little bit about it to us, please?
So fear of cancer recurrence is the worry that cancer will come back if you're cancer-free, or that cancer will progress or advance if you're somebody who's living with cancer as a chronic illness. It's very common. And as a doctor who takes care of people with cancer, I'll tell you that it's something that comes up very often in my practice.
Why does the fear of recurrence increase once you finish cancer treatment?
That's a very interesting question. It's basically because during the time of cancer treatment, people are often busy and they have frequent contact with nurses and doctors and health coaches and support people and staff. But when cancer treatment ends, they find themselves alone. The next appointment may not be for many weeks or months later. And they often feel that that's a time when all the anxieties sort of bubble over and they begin to have a lot of thoughts that they can't really control and start to feel uncertain and afraid.
And I'm sure lots of people will resonate with this, but that thought of, oh my goodness, the cancer is back. Why does that feel so real and so convincing?
Well, the possibility that the cancer could come back or progress is very real. I mean, being diagnosed with cancer poses an existential threat. So those fears are grounded in reality. People know, and many have been warned by their cancer doctors, that the cancer could come back at some point. And so when they experience a physical symptom, such as a headache or maybe some indigestion, often their thoughts run to the worst possible case scenario, and that is that that symptom, which may be harmless, is actually connected to the cancer and represents a symptom of that very real threat that they have heard and experienced and are having trouble dealing with.
Thank you, Lidia. Tabitha, when fear of recurrence shows up for you, what thoughts come to your mind?
For me, as Lydia said, it's linked to symptoms. They're replicable across many things. And for example, a headache is a good example. I think I certainly feel like the vigilance is what helped me catch my breast cancer in the first place. So that vigilance is what I trust. And therefore, that is where the sort of grey space is. When you have a headache, you have a symptom, that vigilance feels like a positive thing. But it's hard. It's hard to know. It's never ending.
And what does that feel like in your body?
It feels like a short, sharp fright when the thought comes to you. And then I will spend some time mulling it over and sort of questioning that thought. And then often I will say to myself, okay, I hear you. I'll watch it for a couple weeks and then we'll make a decision. But the fright doesn't go anywhere. Yeah.
Lydia, what are the biggest triggers for fear of recurrence?
Some of the triggers, as we've just discussed, are physical sensations. So a symptom, headache, indigestion, pain in a bone or someplace in the body. Others may be anniversaries of diagnosis or an approaching scan or an approaching appointment. I hear from my patients that they feel more fearful when they have an appointment coming up, say for a mammogram or for a blood test. Sometimes the triggers can be caused by external stimuli. For instance, if there is somebody who's been diagnosed in your circle, that may trigger your own fears. If you hear something on the news, if there's a celebrity who's been diagnosed or that gets a lot of attention, that again makes it feel very real in a very intimate sense. So it could be an external trigger, something that you have absolutely no control over. It could be something happening to somebody you know. It could be your own appointment coming up, or it may be a physical sensation. All of these things can trigger these fears and fears of recurrence or fears of progression.
And I'm thinking about what Tabitha said earlier. How do we balance being responsible for our body without stepping into just that constant fear and that constant monitoring?
So I think that's really the key, right? Because we can't tell people not to be afraid, right? Any more than you can tell somebody not to cry. So if the fear is going to come, then the question is, what are we going to do to handle or manage it? And the first thing to do is to recognize it. And some people feel that it helps to name it, saying, I'm feeling afraid, or I'm afraid the cancer could come back, by naming it and verbalizing it. Sometimes that helps to actually get a feeling, a little bit of control over what's happening to you. And the next thing is probably to just try to slow yourself down, maybe slow the breathing, maybe unclench the jaw, maybe relax physical tension. Just take a moment to sort of try to ease the body's reaction to that fear, which may be very physical as well. And then perhaps to ground yourself and sort of say, all right, I'm feeling afraid, but, try to ground yourself in the presence. And that's when psychologists often recommend the, 5, 4, 3, 2, 1 exercise, which is to name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, 1 thing that you can taste. And what that does is slow you down and grounds you in the present. Maybe you don't need to do all of that, but you can sort of have your own exercise to just help you feel that you're in the moment. So you've tried to relax yourself. You've tried to breathe into being in the moment. You try to ground yourself, and you've verbalized and named what is actually happening to you. And from then on, different people may find different things helpful. Some may find a distraction helps. Some may find talking to somebody who can give them support and reassure them may help. But that's basically what you can do to develop some way of reacting to help yourself to self-soothe, basically. If that doesn't work, then maybe asking for some help. There are psychologists, there may be buddies, peers, friends who can provide some help for how to deal with that in the moment. And if all of these things don't help, then maybe that's the time to ask for some professional help.
Thank you, Lydia. And we'll come back to that knowing if you need professional help in a minute. Tabitha, what would you say some of your biggest triggers are?
I was just thinking as Lydia was talking about the various options that you come across in your daily life. And I know that actually for me, Breast Cancer Awareness Month is really hard. And it's partly hard because in the UK, I don't know if it's globally as well, but Breast Cancer Awareness Month is October. And I was diagnosed October 11th. And therefore my annual scans are always October. So for me, October is a big, heavy breast cancer month. And I tend to, even now, factor in social plans, buffers, massages, trips away, and try and anticipate that sort of feeling of scanxiety, which is a term that I see bandied about a lot, ahead of a scan. But also, it's not, for me, it's not necessarily the scan itself. It's actually just the feeling of realness that you mentioned, that when your reality comes much closer, the reality of breast cancer comes much closer to your day-to-day life, in the same way that a friend being diagnosed or someone who you knew in one of the waiting rooms who has now sadly died, anything like that just really brings those fears back pretty powerfully.
And in those moments, do you find yourself becoming overly hyper aware of your body? I also heard that you said, actually, that served me.
Yes, because I think when I feel like that, I will react to try and make it better. So I will typically be writing a lot more. I'll be painting a lot more. I'll be outside in nature a lot more. But I think in terms of the symptoms that I feel, actually, when those crop up, and I've had a whole plethora of different symptoms that have been entirely valid. And at the moment, I'm dealing with dizziness, which has been kicking around for 2.5 weeks, which is slightly longer than most people would like. And we're going through the blood test. We're going through the, is it vertigo? Is it, all these different things to look at. And obviously, one of the first things on my list when we were doing the blood test was, I hope there aren't any high inflammation markers or anything particularly off. So even if you do have a genuine physical symptom and it may not be related, it will always feel like an option. So I guess for me, the practical side that kicks in is, well, it could be an option, but it could be something else.
That's really interesting and leads me nicely onto the next question. Thank you. When someone is thinking about that percentage and the risk of a recurrence, Lydia, how should they think about it without them letting it take over?
Let me first respond to Tabitha's comment about October being Breast Cancer Awareness Month. And it is the same in the US. I think it's global. And what I hear from many of my patients is exactly what you just said. They just can't get away from it. In the days when people went to supermarkets, there were tabloids there that had the titles about breast cancer. Football is on TV all the time, and the athletes wear pink socks or pink shoes in solidarity with. Everybody wants to show and express their solidarity for breast cancer and breast cancer awareness, so you can't get away from it. And I have heard for over the years from many of my patients who express the same sentiments that we just heard so clearly from Tabitha, that it's difficult, that it's almost as if you live and you're trapped by external reminders all the time. And that makes it very hard. So it's not just you, and it's not just the UK. I think there's sort of a sisterhood of breast cancer survivors who find it very difficult. And they appreciate the good intentions, but they just find it personally very difficult to be constantly reminded. And let's turn our attention to the statistics and how the cancer doctor or cancer team can present the statistics in a way that is helpful. I think this is a fantastic topic. I wish we could talk about this for hours and include some of the medical people in this conversation as well. I think this idea of providing a prognosis that's based on numbers can be very tricky. And the fact that the cancer clinicians often provide these numbers as estimates of recurrence leaves the patient in that moment dealing with the dreaded number of the percentage of recurrence. And that could be a small number. And instead, the clinician could start by saying, look, there are 70% of people in this situation do just fine. But we tend to consult and dwell on what could go wrong as a way, I think, of steering the conversation towards what can be done to diminish that risk in some cases. And as a result, sometimes people are left with the impression that there is a huge risk when, in fact, the statistics actually can be reassuring if presented in a different way. So this varies from individual to individual. There's no one single scenario, but there are different ways of talking about the risk of recurrence. And there may be some that stoke fears and others that provide more reassurance when you're really dealing with the same set of facts. So I think that it's important to go back, if possible, and have this conversation again if somebody is either unsure or very worried, because in fact, it may be that a different conversation or a renewed conversation about the statistical risk of recurrence may turn into something that feels more livable, more reassuring.
If they do come away thinking, oh my goodness, I'm, got more worry now. Yeah, what can they take back? If they're taking responsibility of the conversation, what do they need to bring up with their healthcare team?
As you may know, I'm a great proponent of clear communication. And sometimes, even with the best of intentions, the communication is not satisfying for either party or both. So I think the best thing to do is to be very direct and say, I need to have another conversation about the statistics and about the likelihood that my cancer will come back. I don't think I understood it properly, and I'd like to check that again with you. Or if I did understand it properly, it's making me very afraid and anxious. I'd like to have another conversation, maybe look at this together again and go over the numbers one more time, or some variation that feels, authentic to the individual saying it. But basically just be very direct and said, I'm worried about this, and this is what I took away from the last conversation. Maybe we can address this in a different way.
And does worrying about it, does it protect us in any way?
That's such a great observation, Steph. I don't think so. I think worry can feel protective in some way, and I think Tabitha was so clear about this at the beginning, sort of saying that being vigilant about her body actually allowed her to discover that she had a problem. But the difference between vigilance and worry is real, right? So how can we keep the vigilance to be a protective buffer for us and not let it spill over into hypervigilance and this sort of almost obsessive search for new symptoms that are really a manifestation of maybe fear or anxiety. And that's a tricky balance, I think, that is hard to prescribe. I think worry may help us to the extent that it keeps us focused on keeping appointments and making sure that we're doing everything within our reach to stay healthy, whether that's protecting our sleep or exercising, eating well, all of these things. But then there comes a point where the worry really doesn't serve us well. And it's not really great living time either. And that's, I think, what we're talking about today as well, when the worry becomes a problem.
I'd like to just talk a little bit about what might make that fear worse. We've spoken about triggers, But are there any habits we might have that keep that fear alive?
I'm not sure how to answer that question about whether or not we have habits that we acquire. I think it's sort of not letting it go, not resolving it, that keeps it present and keeps it heavy. I think if we learn some ways of self-soothing and have an approach, it becomes easier to bear. And I'll give you an example from my clinic. Just a couple of weeks ago, I saw a young woman who was diagnosed very young and is now probably 10 years out from her breast cancer, but still worries and still has fear of recurrence. But she's now acquired some techniques to help her self-soothe. So I asked her about it, and she was very quick, and she told me about the 5-4-3-2-1, and she's done her therapy and she's gone to groups, and she knows that it's still present in her life, but she feels that she has some level of mastery over it. So she doesn't let it intrude into her daily living to the point where she becomes almost a prisoner or it sucks the joy out of her life. She goes on, but she still feels it at times, even though her prognosis is excellent now and it's been a lot of years and she has not had a recurrence. So that's one example just to show you that in the end, I think the best thing we can bring to this is some kindness and a lot of empathy to understand that you can find a way of coexisting or living with it, even if you can't just completely make it go away.
I'm really interested in that context because I think that when you are diagnosed and you go through treatment, there's a natural questioning of why did I get it in the first place? And wherever you land on that will inform your decisions from there on in to proactively be healthy and to look after yourself. And all those things are positive, like you're saying, harnessing the worry to be positive and be healthy and put yourself in a great position. I have also found that there's another layer. And the other layer is that feeling of continually holding that weight. And you go from doctor's appointments to therapy appointments, and all of these feel sort of still slightly within your control. And I definitely have discovered that there's a real feeling of questioning my own safety in my body. And it's that feeling of safety that was taken away at the point of diagnosis that is partly fueling the fear of recurrence. And in my situation specifically, and I'm aware that this is only really relevant to me, but I came off treatment 3 years early. So I was proactively looking at the risk management of doing that because I felt that being in menopause, I was diagnosed at 29, so being in menopause for longer than the research was saying that I needed to be, but I knew that the research was based mostly on people older than me, not 29-year-olds. And I had to really face and make this calculated decision talking with doctors about the risk of my cancer coming back and the risk of coming off treatment early. And I have found subsequently that I thought the fear of recurrence might ease and it hasn't. And I think that's partly down to this feeling of safety within my body that is the thing that is helping that is therapy, not the statistics of whether I will or won't.
I think that's fascinating. And thank you so much for sharing that experience. I think when you're 29 and are diagnosed with breast cancer, as you say, that is, of course, the question, why me? Because it's not supposed to happen. And it's a question that nobody can often answer very clearly. And so it doesn't surprise me that you've continued to live with the repercussions of that early diagnosis. The second theme that we're dealing with here, in addition to feeling perhaps betrayed by the body, which is what I've heard some of my patients say, or the surprise and shock of not having the scientists be able to explain why it happened. And we often look for a genetic susceptibility or an exposure or the kinds of clues that we know may increase the likelihood of developing a cancer at a young age, but sometimes we don't find it and we're left with not knowing. And that is, I think, the second theme here, in addition to the fear, is dealing with uncertainty, dealing with not knowing. And when the science, can't provide the answer, and the intuition doesn't give you an answer either, then people are left with not knowing. And so part of this big challenge, and the reason why sometimes some form of therapy is so helpful in these situations, is because all of us have difficulty dealing with not knowing. And especially after having been in the situation of already having been diagnosed and having to face all of these issues at such a young age.
That's really helpful. It'll likely be different from someone who is dealing with cancer on a long-term basis. And Lydia mentioned before about the discussion around the worrying impeding on the quality of your time. And I think that must be front and center. Obviously, I'm making a huge assumption not being in that position myself, but just want to give that situation some airtime too.
And I guess this is going back to what you touched on a few minutes ago, Lydia, but how do we know when that fear goes from, the normal into the space where we need to be doing something about it, reaching out for support?
I'm going to run the risk of medicalizing it now, but I think that for me, the trigger for recommending to somebody that they get help is when they tell me that they're having these thoughts, and it's intruding on their ability to find joy in everyday life. I think that, to me, is the point where I try to escalate it and say, I know you're doing perhaps what you can, and those who love you and support you are doing that, but I think this is a point where I think you could use some help from a professional. Sometimes being in a group is very helpful, where people can just talk about it and these fears are normalized and people learn from one another, and everybody gets also a little bit of joy from helping others through their own experience and gets some help from others. But it's sometimes time for a one-on-one with somebody who is a specialized therapist in this kind of a problem.
Tabitha, has the fear ever stopped you from doing anything in life?
Practically speaking, yes, because I probably took my health seriously anyway, but I definitely take my health seriously now. And there's two scenarios that I can think of. One is if I do have something like some bleeding from my bowel, that sends immediate triggers to the GPs, and they crucially take that seriously for me too. So I've found that I am very well looked after off the back of a cancer diagnosis, which feels like a silver lining because it means they take things seriously, but also it's a two-sided coin, because on the other side is actually the validation of my fears that it could be something. If the doctors are taking it seriously, then that therefore makes me think, okay, so this could be something serious, where I may have gone into the appointment not necessarily thinking that as severely as I came out thinking it. The second scenario actually is on a daily basis, because I'm managing the sort of mitigating the risk factor that I spoke about before. Because I'm managing that on a daily basis, I'm managing my energy levels and not pushing myself too far. And therefore, if I'm already feeling quite burnt out by the day, the severity of pushing through is absolutely sort of painted with recurrence. The reason why I'm not pushing through is because I don't want to put my body in that position. So I will be behaving in a way that factors in that fear of recurrence. But whether that's practical or not, it is the reality. And, actually we were talking on a podcast previously about getting back into work and finding the joy within life. And I'm 33 now, so I'm still single and dating and wanting to live my life. And I don't want to forego a work event or a friend's wedding just because of that fear, because I've had a tough week. So it's really looking at that quality of life and working out for me where that line is. Am I going to be drinking alcohol? Unlikely. If it's a very special occasion, potentially. But all those things is part of managing the risk that in the way that I see it. And the way that I see my risk will be different to how other people's reality, but also how they manage their risk too.
Lydia, what's your response to that?
That I'm learning from you, Tabitha. I think it's a very honest, heartfelt response. What I'm learning from this is that Tabitha has become very self-aware and is doing a tremendous amount of work to deal with the body and the mind and the mindset that allows her to go on. She's basically has to make these decisions probably all the time about how to apportion her energy, what she's going to choose to worry a lot about or little about or not about. And the other important theme I'm picking up on here is that Tabitha also has a relationship with her GP. And that's important. In my experience, often our young patients with cancer, especially within the first few years from their diagnosis, come to the cancer doctor for everything. And that already means that in their own filter, they think that anything that happens is the concern of the cancer doctor rather than perhaps the GP, or as we say in the US, primary care. And I think that's another interesting topic that we can discuss is where do you go if you feel that you have a new physical symptom? Where does your mind take you right away? Who is the first person that you tell about this, and where do you go for help? And I think this is an important part of dealing with fear of cancer recurrence, right? If your first thought is the headache is a brain metastasis and you start to spiral and can't get rid of that thought, then you're more likely going to call your cancer doctor, your oncologist, instead of just saying, well, I have a headache or I'm dizzy or whatever, I'll call my GP. If this doesn't go away in a few days, and then I'll take it from there. And I think all of these sort of micro decisions that people are making are ways of also sort of estimating how much they still are worrying about this. So the worry could become a fear, or the worry could be dealt with. And I think all of these little decisions are part of the big conversation we're having is what do you do when the body talks to you, right? Where do you take it? How do you deal with it? And I think this is something that different people will probably resolve in different ways.
What does the research show helps fear of recurrence?
Yeah, so again, I think that it depends a little bit on what we're dealing with. If we're just dealing with the abstract worry, then I think all of these self-soothing techniques and grounding techniques can help. First to name it, then to ground yourself, then to find some exercise that allows you to slow down, to relieve the physical tension, whether it's thinking about your breathing or your back muscles or some mini or micro meditation, something to just ground you and just let it pass a little bit. And then maybe looking for some support externally to you. So picking up the phone and calling somebody you who knows about this and say, I'm starting to feel afraid and looking for support or distraction, or making a plan and saying, I'm not going to worry about this until tomorrow at the same time. And then just trying to basically set some boundaries even for yourself about this, because you recognize that what you're experiencing is the fear. Now, if you also are dealing with a new symptom, then you also need to have a strategy and a plan of how you're going to deal with that symptom, who you're going to ask for help, and how you're going to proceed. So I think there's sort of different ways of thinking about this depending on the time of day, whether it's 3 a.m. or 10 a.m., because in the middle of the night, maybe you don't want to call a friend, but you need something just to keep you going. And then you need also to think clearly about a strategy if you're dealing with a new physical symptom and you think that at some point you're going to need some help.
Thank you, Lydia. And you touched on this earlier about certainty versus uncertainty. Which one should we be chasing? Is it the certainty, or do we need to learn to live in that uncertainty?
Learning to live with uncertainty is something I think we all need to do. And in this particular conversation, the uncertainty is represented by illness and disease, but there are all sorts of other forms of uncertainty that we deal with in our lives, right? So I think that's difficult for us. I think that we are sort of brought up and live in a society where somehow we feel that we just plan things properly, we have actually more control than we really do. And so for some people, it's become very difficult, at least from what I see in my practice, to just even understand that there are certain things that, we don't know how they're going to work out, and we can't control them even if we assemble the best minds and the best technology and the best predictions.
And what's one thing someone could do to allow themselves to be a little bit more comfortable in that uncertainty?
Well, it depends on how they're wired, Steph.
Sorry, Lydia, I'm
Some
coming to you
people,
with all of the the big life
yes, but I
questions.
think it's interesting, in the doctor-patient relationship, which is where these things play out in my little office. I think some of it depends also on my anxiety or the clinician or the doctor's anxiety. If you have a very anxious doctor and a very anxious patient, perhaps they don't get very far. So I'm just trying to introduce some humor here, but to say that a lot depends on who is taking part in these conversations and what is, being brought to the conversation. I've been in certain situations also where my patient is accompanied by family members who express high levels of anxiety about it and also have fears. And so, there may be more than one person that we need to attend to. So I think I'll bring it back to something that's very simple, and that is to know oneself and to know what one can deal with. And there may be times in one's life when one has the ability to absorb more fear and anxiety than in other times because of other things that are going on, whether we're living at a time of war, a time of peace, whether we're financially comfortable or struggling. There may be many things that make fears in general bubble over. So, I've had patients who've been very worried about something happening to a family member, and that also, um, you know, determines how much they have to work with in terms of being able to sort through their own problems. So instead of giving just one recipe, I would say, I think starting with, trying to do a bit of an environmental scan, trying to do a bit of a 360, what else is going on in my life or my patient's life or my loved one's life, and seeing what resources internally they can bring to this. Perhaps all it takes is just being centered and having some sort of a practice. Perhaps it's going to take a whole lot more, depending on what else they bring to this and what other sources of support they may have in their life.
Thank you, Lydia. Tabitha, what genuinely helped you or has helped you with the fear of recurrence?
What has helped me? Trusting the doctors. I think if I come from a family of doctors, so I have been very aware that hospitals for me are places where my family have worked or work, and therefore they're not scary, intimidating places. And I know for some people they really, really are, and it's entirely valid why. So that as a sort of starter block, I feel fortunate that that isn't the case. So I am happy to call a doctor if I have a fear. And I trust that they will give me the answer that is most appropriate. But I will also say that there's a huge part of advocacy that if there is someone that is living with secondary breast cancer, for example, the fear is a new symptom. And I obviously, again, I don't have this. I'm making the assumptions. I don't want to put words in other people's mouths, but I can imagine that actually that's a very ever-present sensation, and the conversations that you're then having with your doctors about escalating certain symptoms or anxieties that you're feeling, it has a entirely different dynamic. So from my perspective, something that I know has helped is talking to the doctors and having that trusted conversation, and then going outside in nature. For me, that really is something that will always make me feel better. And if I'll usually give myself a timeline of 2 weeks, because I think with the female cycle, that in 2 weeks' time, if I'm still worrying about it, then that sort of validates me to go to the doctor to myself. That's my own sort of protocol that I follow.
So you make a note to yourself, come back to it, pop it in your calendar.
Yeah.
Okay. And if someone was in their first year post-treatment and they had these fears, what would you say to them?
Actually, just on that, I don't make a note in my calendar, because I think if I've forgotten about it in 2 weeks' time,
Okay.
then it isn't something that my body and I'm worried about. I think if I made a note in my calendar, then it would perpetuate the,
Oh, that's
the concern.
interesting.
Yeah.
So you don't make a note
I don't
anywhere?
make a note, but I think if it reappears, like with this dizziness, if it doesn't go away, then I know that I'm not making it up. And that's kind of my psychosomatic control element, that I'm thinking, well, if it was something that I was anxious about and that's where it came from, then if I'm, feeling pretty punchy because I'm in a different phase of my cycle and I'm out visiting friends and it doesn't appear, then it doesn't hold the same gravity in my mind. But if it does, then I will go to the doctor.
So if someone is in the first year post-treatment, they have these fears, what would you say to them?
It's valid. I mean, that's the main thing, is that it's entirely valid for you to be worried about this. I mean, it's always helpful to hear when Lydia said, like, this is grounded in reality. It is. There's no escaping that. And I think hearing that just slightly just makes you breathe a bit happier. It is entirely valid. I think the next step, though, is where you're then calling into question the quality of your life and how you want to play this. Do you want to spend time thinking about this today? Do you want to do something proactive? Do you want to actually meet your friend for a drink? Or, do a yoga class on YouTube? What is it that you feel like you want to do next? And I guess that second section is where you have more control over what you react to.
And Lydia, this leads me on to asking you, if someone has this fear and they want to communicate it with friend, family member, doctor, what one sentence could they have in their back pocket that they could use?
I'm worried and I need your support. Again, just being very direct. If you are worried, then I think it's important to say that that's why you're calling, or that's why you're calling your friend or your doctor. I am worried this could mean that my cancer is back. So you put it right out there. Can you help me think through this? Can you help me make a plan for dealing with it? So I think that if you're looking for some sort of a partnership or some sort of validation or plan, depending on who you're calling, I think being direct helps. And the other thing I would say is that from my point of view, if you ask me the question of how can the doctors and the care team help, I think that what we can do is express our feeling that we're confident that you can manage it. And to help you to feel that your body can handle what's happening to you, and that we feel confident in your ability to manage it. And if you don't feel confident, then I think that sort of names the problem. Then the conversation becomes more about, well, what is it that you need in order to feel confident, and where are you going to get what you need? Is it more knowledge? Is it more understanding of numbers? Is it just some mental health techniques? Is it support? And I think that's where the conversation can get practical and useful to help somebody deal with it. Again, recognizing that it's valid, but then needing a strategy for moving forward with it.
They're really useful. Thank you, Lydia. I just would love to ask you both, is there something that we haven't covered on fear of recurrence that you think is really important we talk about or you share?
Bringing this up during regular encounters with the cancer team whether it's a cancer doctor or the nurse who's doing this, is really important. So to have like a few minutes of the visit dedicated to just talking about this. Are you, whether it's that the clinician asks the question or the patient volunteers that, but really addressing it right there and then. Like, and then we actually also normalize it in a way and make it part of what we talk about, and we follow it and track it over time. Is this getting better? Is this receding? Is this the same? Again, if I may wear my research hat for a moment, the research that we've done on young women with breast cancer is that there's a substantial minority of young women who have a very severe fear of cancer recurrence. And what we have shown is that that does not just decrease over time, that those who have a very deep fear, often this deep fear persists, even 5 years after the diagnosis. So waiting for time to heal may not be the answer for everybody. In many cases, time does heal and does mitigate these fears, but when it really is very important, I think taking it seriously and trying to have a plan and making referrals and addressing it is the right thing to do.
Yeah, that makes total sense to me. And I think something that we haven't mentioned, but off the back of that, is the PTSD element of getting a diagnosis, and that being a very real factor in all of this. So in the same way that you sort of build on the safety, the feeling of safety within your body, and feeling unsafe can persist throughout treatment and beyond. I feel like it's likely exactly the same with any psychological loop that you get into. And when that is to do with how you're feeling in your body and whether you have an ache or pain, I mean, how prevalent and persistent is that going to be? I mean, that is arguably, it has the potential to be all day, every day. So yeah, if it's turning into a psychological loop, there's no shame in that whatsoever. It would be entirely natural for that to be the case, but it would need a different conversation, like Lydia's mentioned.
Excellent. Thank you so much, both. Lydia, are you happy for us to run through a quick fire round?
Is now a good time to jump in?
Yeah, go for it.
So I just wanted to say that if you are listening to this, the reason that you would have clicked on a video about recurrence of cancer is likely because you already are worried about it. So I'm feeling anxious even talking about it. So I can only imagine if someone's watching it that they will probably be feeling the same. And I was just thinking that what I tend to do is watch a comedy sketch or a bloopers of Friends, or just do a little shimmy to some good music. And I just wanted to put that out there as something that might make you feel better now.
That's great. Thank you so much. There's a really good BBC Funny Animals video, which I feel sits in that category.
We'll loop it in.
Yeah. It's about 20 years old.
Links in the bio.
The quality's terrible. Excellent. What do patients often expect life after cancer treatment to be like, and what is the reality?
Patients often expect life to snap back into pre-cancer mode, but that is not the reality. For many, there are all sorts of psychological and physical complications that don't just go away with the last drop of treatment.
What tends to surprise people the most once treatment ends?
What tends to surprise people most at the end of treatment sometimes is that their anxieties bubble over and they have no place to send them because their contact with all of the healthcare professionals is not nearly as often as it was during active treatment.
What do you wish more patients were told before treatment ends?
I wish more patients were given a bit of a plan and some help in thinking through and strategizing how they're going to deal with some of the symptoms that may occur between the visits with the healthcare professionals and after their active treatment is over. I think we don't prepare people to face the many challenges of survivorship, both navigating the healthcare system sometimes, knowing who to ask questions to, but also knowing that it may take quite a while for their body and their mind to find their new normal.
What seems to help people the most in the months after treatment?
What helps people the most in the months after treatment depends a little bit on what matters to them in their life. I mean, it's for some it may be, having more time in nature with family, going back to work, feeling their body heal, their hair grow back, whatever it is. So I think that's really highly variable, but perhaps the common response is just to feel more normal, just to appreciate some of the things that are normal, such as the flowers blooming in the spring, and just not having to worry about big things, but being able to just focus on the small things that make our lives lovely, and we sometimes don't even pay attention to.
It's interesting you said nature because being outdoors has been the top answer, I think, for that one. From what you see, what is it really like when someone finishes cancer treatment?
Finishing cancer treatment is complicated. It's not as simple as just, ringing a bell and giving a diploma and hugging and saying, now go. Some people have to sort of rethink who they are and what matters, and, relationships may have shifted, opportunities may have gone by. So it's a really very interesting and complicated time of life that few people really appreciate unless they're sort of in it.
What is one small, realistic step someone could take this week to support their mental well-being after treatment?
One small step somebody could take is to reflect on the experience, on the meaning, and what it has meant for them, and how they are telling their own cancer story. Both they're telling it to themselves and telling it to somebody else who they may meet or may choose to share it with.
If you could send a message to someone finishing cancer treatment, what would you want them to know?
I'd want them to know that the months and years that follow cancer treatment are probably going to be times when they're going to experience some turbulence inside, as they process the experiences that they've gone through. When somebody's in the midst of cancer treatment, they don't have time often, or they choose not to, or they don't have the mental energy to really think about everything that's happening to them as a whole human being. And it's when the cancer treatment is over that often this important emotional and psychological and existential work really begins.
What do you wish more healthcare professionals understood about life after cancer treatment?
I wish more healthcare professionals understood the challenges of being a cancer survivor, and especially some of the mental health challenges and worries and fears, such as the fear of recurrence, and really address those in a proactive way and open up the space for their patients to talk and share some of their fears and worries and concerns, even if there is no crisis, to be able to talk about it, and come together as fellow human beings, and provide some help.
Brilliant. Thank you so much, both. I'm really grateful for your time.
You
Thank
are
you.
welcome.
Thank you,
You
Lydia.
are
Thank you
welcome.
so much.
Sure.
Fear of recurrence is a very common experience after cancer treatment. Today, Lydia shared practical tools that may help when worry starts to build. Here are a few of them. Be present using the 5-4-3-2-1 exercise. Name the feeling, which can help take away some of its power. Contain the worry by giving yourself a set worry time. And reconnect with what matters, because fear often softens when we focus on what gives life meaning. Perhaps choose one and see how it feels to practice it this week. Thank you for listening. If you'd like support or community, you can find free online workshops, expert sessions, peer groups, and our 6-week program at life-aftercancer.co.uk. If this episode was helpful, you can follow the podcast or leave a review. It helps others find these conversations. And support information is always available in the show notes. Take care, and we'll see you next time.